Two things we see in breast augmentation surgery are animation deformity and capsular contracture. Sometimes patients confuse these two entities and wanted to set the record straight. Animation deformity is when you place the implant under the chest muscle and then with flexion of the chest, the implant moves and creates a line that can be deforming. It only happens during movement, which is why they call it animation deformity. It's one of the unfortunate downsides of placing the implant under the muscle. Most doctors place the implant under the muscle and counsel the patients that the advantages of doing submuscular augmentations far outweigh the adverse sequelae of having animation deformity. Capsular contracture, on the other hand, is an unfortunate complication of breast augmentations, which we see very rarely, so it's not common. But this is the buildup of scar tissue around the implant. When the implants are placed, you want to use a no-touch technique. You want to make sure you have meticulous hemostasis or control of the bleeding so there's no blood in the pocket. Make sure the pocket is crystal clear. Use antibiotics to irrigate the pocket as well as dilute betadine, which kills bacteria as well. Once the pocket is completely clean, you place the implant using a no-touch technique, and then you don't touch the implant as you sew everything shut. I think that protocol, the use of betadine, has really virtually eradicated capsular contractures, but they still can occur. If you get a capsular contracture, the buildup of scar tissue, this can cause upward displacement of the implant, and the breast will feel hard, almost like a scar ball. It's not the implant that's gotten hard, it's the scar tissue around the implant. Treatment for animation deformity, treatment for capsular contractures reflects the etiology of what's going on. If animation deformity is bad, it bothers you a lot, you can change the pocket location. You can sew the muscle back to where it came from and then use a subfascial or subglandular, placing the implant over the muscle to prevent animation deformity. And we do this from time to time. If capsular contracture is the issue, the first step is that you want to remove the capsule, then repair the pocket before you replace the implant, and hopefully the capsule won't come back. If you have a recurrent capsular contracture, that's an even bigger issue, and we do have some things on down the line that we can offer. But for the most part, the capsulectomy, removing and replacing the implant, is the way to go.